Happening on the sidelines of the International Conference on AIDS and STIs in Africa, ICASA, the Africa Leadership Meeting brought together heads of state, first ladies, as well as different stakeholders in the health sector to discuss domestic investment in health. Statistics show that though Africa accounts for 24% of the world's disease burden, the continent only receives 1% of global health spending. President Paul Kagame, who once served as the chairman of the African Union, said that funds must be allocated to programs that work.
Partnerships are indeed essential for continued results in global health. However, it is past time for governments to allocate adequate resources in national budgets for the healthcare from which our citizens benefit so much. However, spending more money is not a silver bullet. Funds must be spent well on programs that work and are sustainable. Once again, the example of community health workers in numerous countries on our continent demonstrates a policy that is both effective and affordable. The best way to convince governments to spend more on health is to provide evidence about how to spend better. The next African Union Summit is an opportunity to further advance this agenda.
African Union Special Envoy on Women, Peace and Security, Benita Diop, highlighted several action points on domestic investment in health on the continent, spearheaded by the African Union Commission.
The establishment of regional health financing hubs to support country effort to strengthen health financing system. Second, the development of domestic health financing tracker that will enable AU member states to measure progress of resource allocation, and then the key reform toward increased domestic financing. The digitalization of the Africa scorecard, that's the third, on domestic financing for health, and the tracker to avail data widely and monitor health financing. Fourth, the adoption of an accountability framework defining roles and responsibility of different stakeholders to enhance collaborative implementation. Fifth, the setting up of technical working groups to encourage diverse solutions from a vast pool of technical experts across both public and private sectors to make sure no health financing dimension is left uncovered.
According to the Permanent Secretary in the Ministry of Health, Nyemazi Jean-Pierre, Rwanda is among the countries that has fulfilled its pledge to allocate 15% of its national budget to the health sector. Statistics show that 50% of deaths of children under the age of 5 and 70% of people living with HIV are in Africa. More than half of this population lacks access to essential health services. The continent has given itself a target of ending 3 epidemics, namely AIDS, tuberculosis and malaria, as well as achieving universal health coverage by the year 2030. Fatima Tessi reporting for RTV, Kigali.